I must admit I was naive, but I could never get cancer, but here we are today. It's happened. I guess being around my big Greek family and seeing my grandma in the kitchen baking and cooking all the time, so that passion really led from there. I was lucky enough to be given the name Zakaria, which means sugar translated. To be cast as a contestant on Zumbo's Just Desserts, it was a dream come true. I was still working in marketing in Melbourne, and I saw that as my opportunity to really break into the field of dessert making. So after 14 years in Melbourne, I packed my bags with the intentions to move back to Adelaide and start my own business, Zachary Desserts. I was running the business for just under 18 months and then had this unexpected thing happen in my life, which caused me to pause. For me, the symptoms I noticed at first, I was that person that would go to the bathroom once a day. But yeah, I've noticed I was going back 3 or 4 times a day as opposed to the once. So that was really not normal for me. I noticed after eating particular foods, I would get a bit of a reaction of bloating, pain as well, like cramping. I noticed a bit of blood in the stool, or when wiping. I guess I was at the gym, so the typical response is just a hemorrhoid. I was quite adamant that I was a celiac, to be honest.
It's important when someone under the age of 50 presents with symptoms such as altered bowel habit or bleeding from their bowel that a thorough investigation is performed. This includes a physical examination as well as appropriate blood tests, and if need be, referral to a specialist for a colonoscopy or imaging. If someone presents early, and by that we mean if they present when they first notice their symptoms, there's a good chance that the cancer will have not grown outside the bowel. If that's the case, then an operation can offer up to a 90% cure rate for colorectal cancer.
I booked to do blood tests with my GP, but everything came back clear. So that left me confused. My irregular bowel movements weren't sitting right with me. So my GP referred me to a specialist who proceeded to book me in for a colonoscopy. I remember Dr. Hall mentioning to me that he would provide me with results pretty much instantly after the colonoscopy. I guess being optimistic, I was hoping for some good news, but unfortunately I did receive the news that I had bowel cancer. I do remember the initial reaction. It was pretty much instant shock. At that stage I didn't know how severe the cancer was or what stage it was at, and I think at that moment I realised, wow, like my life has now just changed like that. So I remember Dr. Sam Hall referring me to my surgeon, Professor Peter Hewitt, who I had a consultation with. So he explained the cancer and the tumour and what was found in more detail for me.
I started my career as a colorectal surgeon at the Queen Elizabeth Hospital in 1994, and at that time it was uncommon to see someone present with colorectal cancer under the age of 50. In my current practice, I'm seeing more and more people come to see me with colorectal cancer under the age of 50. The difficulty is with people under 50 is often their symptoms are dismissed or misdiagnosed by health professionals. It's so easy to say that someone who has rectal bleeding, it's probably due to hemorrhoids without them undergoing thorough investigations. In addition, it's very common for people under the age of 50 to dismiss their symptoms, thinking that passing blood is normal or probably just a hemorrhoid, without going to see a health professional to get proper investigations.
I did publicly go out with my story on my socials. I guess instantly I just wanted to raise awareness, and I felt I had to do that because if I put it out there, I couldn't back down in how I was feeling. So I wanted to be a role model, or just even get people to start thinking about this, because being at 40, I didn't expect to be told I was going to have bowel cancer. So I remember after surgery, I was in ICU, and the first thing I did was sort of touch my stomach, because Professor Peter Hewitt said there might be the chance I might need a stoma, and I remember not feeling anything. So that was quite a relief. This is my first time in hospital, to be honest, so I had no idea of what to expect. The nurses here at Ashford were completely lovely to me, and supported me through the next 3 or 4 days just to heal and recover. Recovery has been amazing. I really tried to sort of get myself moving a bit. I felt that was important.
Yeah, Zach made an excellent recovery from his surgery. And many patients now, the surgical techniques used are laparoscopic assisted surgery or robotic assisted surgery. This allows minimal incisions to be made in the abdomen so that there is decreased pain post-operatively and their recovery is fast-tracked.
Treatment for me now is I'm on chemo. Unfortunately, some of the cancer cells had reached my lymph nodes. The good news is that out of 23 lymph nodes that were removed from my body, 6 were present with the cancer cells. Theoretically, I should be cancer-free at the moment. It's just so we can stop these cells forming into tumours. So I have to go through a 6-month treatment of chemo. If you know something's not right, if it's out of the norm, just check it out. Don't be afraid to talk about it. Don't be embarrassed. It's really hard to sort of think about the future at the moment because this is sort of still fresh for me. I do want to continue doing what I love to do, which is baking and making sweets. However, I think when you're hit with the news of cancer, it does sort of change your mindset a little bit. And I know it's such a cliche thing to say about patients or cancer patients wanting to help raise awareness, but I feel like sort of that's my calling a little bit, and maybe there's a reason why I sort of had the opportunity to be on a public profile like Zumba's Just Dessert. I just want to really help encourage others to go and get checked out, not ignore symptoms. It can happen to anyone.